Good morning. My name is Reem and my partner's name is Farah. Our topic today is the values of health promotion in ECE.
The first article, title, The Long Arm of Childhood Health, Linking Childhood Disability to Late Midlife Mental Health, by Kinsey Latham. The first key issues. Physical issues during childhood include disability, impact on adults' physical and mental health in later life. Secondly, circumstances in childhood which include social and health factors impact adults' physical and mental health in mid to late life.
The determinants of health for the first article. The first one is healthy child development. The article states that early life health issues such as childhood disease and poor fetal conditions are associated with health issues in mid to late life. This indicates that health conditions in early life, such as childhood disease, are the cause of health conditions in adulthood, which means that their health had negatively affected because the unhealthy conditions and the unhealthy development of children in early life are the reasons for adults to be unhealthy in later life as well. And this includes physical and mental health issues. So this has been identified under the healthy child development determinant of health. The second one is income and social status. The article states that there is a robust association between socioeconomic disadvantage and poorer mental health status. So this quote indicates that poor socioeconomic status is the cause of mental health issues in childhood because low social status and low income affect children's mental health since they can develop depressive symptoms due to their financial hardship. So this has been identified under the income and social status determinant of health. Now, the values of health promotion for this article. The first one is inclusion. The article states that individuals with a disability in early life suffer from poor education and employment consequences compared with other individuals who do not have a disability. So this indicates that there is lack of inclusion because individuals with a disability are not included with other individuals since they are not given the same education and employment opportunities. So this value needs to be improved. They should be included within the society. They should be given the same opportunities of education and employment. The second value of health is respect. The article states that individuals with a disability who experience the disadvantages in early life, such as stigmatizing labels, suffer from health disadvantages in mid to late life. So this indicates that there is lack of respect because when children with a disability experience stigmatization, this means that they are disrespected. They are not given respect by the society. So this value needs to be promoted because they should be given respect in order to be happy and live without experiencing any depression.
Features of health promotion. Building on strength and assist. Intervention designed to improve or maintain functional health status for individuals with childhood disability could improve mental health outcomes. It assists children with disability to improve their functional, physical, and mental health and assisting their families by working on improving their children's health since they provide intervention services for children with disability. Secondly, using multiple complementary strategies. Children and adolescents with disability could benefit from early life programs and services that promote educational and employment opportunities. By providing multiple and integral approaches to attain goals such as providing early learning and care program to support children and their families, this code shows that children with disability have access to early programs and services to help improve their education and help them reach better employment in future life. The second article, kids need to talk to. Inclusive practice for children's health care, education and participation, by Donna Kohler. The second article, first, key issues. Children with a chronic medical condition tend to be excluded from healthcare decision making. Secondly, These findings indicate that in pediatrics, children are predominantly viewed as being in need of protection, not participation. The traditional medical model focuses on capacity based on age, preventing young patients from exercising agency and gaining mastery.
Now, the determinants of health for the second article. The first one is healthy child development. The article states that children's competence and autonomy mainly develop through direct social and personal experience and not through age and physical growth. So this quote indicates that children with disability and other medical issues develop healthy competence and autonomy through social and personal experience, which include social interactions and communication with their friends, family members, health practitioners, doctors, and nurses, and not just through developmental stages. So this has been identified under the healthy child development determinant of health. The second one is personal health practices and coping skills. The article states that there were some, however, who participated in regular self-care tasks, such as taking their medicine, eating right, and doing physiotherapy. So this quote indicates that children with health issues have some coping and self-care skills since they are taking their medicine and eating right by themselves, so they are developing self-resilience and enhancing their health. So this has been identified under the personal health practices and coping skills determinant of health. Now, the values of health promotion for the second article. The first one is inclusion. The article states that we propose that the universal design for learning be adapted in pediatrics. The model presents exemplary programs as inclusive, accounting for the needs of all children through multiple means of engagement and expression. This quote indicates that the universal design for learning is an inclusive program because it provides equal access for all children with medical issues to participate and engage in healthcare decision making, which means that those children can be included within the society. So this has been identified under the inclusion value of health promotion. The second one is respect. The article states that respecting the competence of all children in today's diverse classrooms has resulted in the implementation of the Universal Design for Learning UDL. This quote indicates that the abilities and competence of all children with medical issues are respected through the design of the Universal Design for Learning UDL because all children with health issues are included in learning and engagement, so their competencies are respected, and this has been identified under the respect value of health promotion.
Features of health promotion: taking participatory approach. Participants recommend that healthcare providers start with assessing whether children are interested in learning about their care and how they wish to have information shared. This approach helps the children to have the opportunity to share their idea and interest about their care and health. Secondly, using multiple complementary approach. Children should be provided with choices and activities that promote their sense of mastery and self-efficacy based on educational models such as UDL. UDL incorporates multiple means of representation, expression, and engagement.
These are the references. Thanks for listening.